How government solved the healthcare crisis. Medical insurance that worked until government fixed it. By Dr. Rod Long. Today, we are constantly being told the United States faces a healthcare crisis. Medical costs are too high and health insurance is out of reach of the poor. The cause of this crisis is never made very clear, but the cure is obvious to nearly everybody. Government must step in and solve the problem. 80 years ago, Americans were also told that their nation was facing a healthcare crisis. Then, however, the complaint was that medical costs were too low and that health insurance was too accessible. But in that era too, government stepped forward to solve the problem, and boy, did it solve it. In the late 19th and early 20th centuries, one of the primary sources of healthcare and health insurance for the working poor in Britain, Australia, and the United States was the Fraternal Society. Fraternal societies, called friendly societies in Britain and Australia, were voluntary mutual aid associations. Their descendants survive among us today in the form of the Shriners, Elks, Masons, and similar organizations. But these no longer play the central role in American life they formerly did. As recently as 1920, over 1/4 of all adult Americans were members of fraternal societies. The figure was still higher in Britain and Australia. Fraternal societies were particularly popular among blacks and immigrants. Indeed, Teddy Roosevelt's famous attack on hyphenated Americans was motivated in part by hostility to the immigrants' fraternal societies. He and other progressives sought to Americanize immigrants by making them dependent for support on the democratic state, rather than on their own independent ethnic communities. The principle behind the fraternal societies was simple. A group of working-class people would form an association, or join a local branch or lodge of an existing association, and pay monthly fees into the association's treasury. Individual members would then be able to draw on the pooled resources in times of need.